Okay, well, it's 9 o'clock, I just wanted to call this meeting to order. So good morning, everybody. Jamie Dolan, Director with Correctional Industries. So for the time being, I will do a quick roll call. Do we have Representative Dan Griffey? Representative Mary Fossey? I think I see you logged in.
Hello.
Good morning. Senator Claire Wilson. Senator Matt Banky. Okay. Suzanne Gordon. Okay. Christina Davis. I see you logged in. Good morning, Christina. Lauren Taylor. Okay. Good morning, Terry.
Good morning.
Do we have Chris Elwell? Jim Huffman. Mariana.
Present.
Good morning. And Karen Duff. Okay, thank you. We'll continue to watch and circle back. Good morning, Senator Wilson. Thank you for joining us today.
Nice to be here, finally.
Yeah, we're happy to have you. So Jamie Dolan, Director with Correctional Industries. We were just getting ready and taking roll calls.
Excellent.
So first and foremost today, we Secretary Strange and Sean Murphy and Assistant Secretary Danielle Armbruster, they all have alternative engagements today. So unfortunately, they aren't here with us today. But of course, I just wanted to welcome everybody to the last quarter meeting of 2023. Can't believe December is already here. But with that being said, I do want to take a moment to thank Suzanne Gordon and Jim Huffman, as this is their last meeting serving on the Correctional Industries Advisory Committee. So I do appreciate their commitment to DOC Correctional Industries Advisory Committee. We do recognize that not only is it a time commitment, but also the conversations and perspectives that lend themselves to the committee, and working towards that continuous improvement in how we serve the incarcerated population within the Department of Corrections. So we've certainly been privileged to have that service, and I know we have a couple members that will be joining the committee beginning in 2024, and we're excited to have them in attendance today, just listening to today's meeting. So for those of you that will be joining the advisory committee, we look forward to formally having you at the next meeting. So with that being said, the Correctional Industries Advisory Committee 2024 schedule has been released. We've submitted all of the dates with the state registrar, and at this time, based on the feedback that we've had with the committee members, it seems that the combination of in-person at CI headquarters, which is where some of us are located today, as well as a virtual attendance option, is what we will continue forward in 2024, as it seems that allows more people to attend. So those meetings have been posted, and invites will be sent out. So as a reminder, as this is a virtual meeting, this meeting is recorded. We will be posting the recording, of course, on the website, as well as meeting minutes will be taken. As with it being a virtual meeting, we do ask that if you're not speaking, that you do remain on mute, just for the sake of the ability for everybody to hear. So as we move into the business meeting of today's portion, I just wanted to review if there was any questions from anybody from the June 1st meeting. I know we went over those at the September 7th advisory committee meeting. At that time, we did not have a quorum to vote on the meeting minutes. But just wanted to ask if there was any questions from the materials that were sent out from the June 1st meeting or the September 7th meeting. And I know as of right now, we don't have a formal quorum to vote on the approval of those meeting minutes. So at this time, we will just move forward into the next portion of today's meeting, which is hearing from our counterparts within the reentry division. We have a presentation on the reentry systems with Misty Patterson. So good morning, Misty. So at this time, we'll just turn it over to you to present to the committee.
Perfect. So as she mentioned, my name is Misty Patterson. I'm one of 3 reentry systems managers. I cover the Southwest region, so from Pierce County all the way down to Vancouver. We have Sean Cornett covering the Northwest region, so King County all the way up to the Canadian border, and we have Susan Piccinini, our 3rd manager, and she covers the whole east side of the state. We currently have 30 reentry navigators. 2 of our navigators are cultural specialists, so they focus on our veteran population, our Alaska Native and American Indians. We have 2 resentencing navigators, one on the east and one on the west, similar to the cultural specialist. And they work with our virtual hearing tracker to identify those that are impacted by sentence restructure, and they'll work with those that are getting released early. All of our other reentry navigators are spread across the state. They cover our reentry centers. They're assigned a facility, and they'll have their own specific area of coverage. Sorry, let me pull this up on my phone because I can't see the screen. Okay, so what our reentry navigators do, so our reentry navigators assist our population in the development of individualized reentry plans. So at our reception centers, every individual entering our facility will receive a reentry envelope. That reentry envelope is their portfolio. It has a checklist on the outside. We modeled that after the federal system. We kind of looked at their folders and developed one for our population. This is a document that they can start accumulating all their certificates that they've received while they're incarcerated, maybe building their resume. It's got this checklist so that they can start building their own portfolio. Inside those envelopes, we have their individualized reentry plan, and that's not the offender release plan, it's their plan. It's the individual's plan, which they identify their own goals, they start identifying their own needs, and what they want to do throughout their transition. We also provide them with a SMART goals checklist in that folder so that they can start establishing realistic goals for themselves. We also have the release needs survey, and they'll use that as a template when they begin to transition out of the facility. And this will identify those basic needs during that kind of critical area between 72 hour and week of their transition. What are those needs that they're going to need upon transition to the community? And it really gets them thinking about starting to plan for themselves and think about what those needs are. Our navigators facilitate what we call as RTMs, or reentry team meetings. So when a navigator is assigned an individual, they'll schedule this reentry team meeting to include, it could be their facility counselor, the individual themselves. If they're releasing out onto supervision, we'll include their CCO or their corrections specialist. Maybe it's a community partner, somebody that we're referring the individual to. We include health services, so if there's a reentry nurse at the assigned facility, if there's the site social worker, they'll get the invite. If they're being referred to MAT services or medicated assisted treatment, we'll include the MAT service staff on that call as well. So it's ultimately it's a wraparound meeting to meet the individualized needs and those folks that, will be working with that individual. They'll on that RTM, they'll go over that release needs survey to discuss with them what their transfer day looks like. We'll invite that CCO and let them talk about what their reporting conditions are. Maybe they have some upcoming appointments, the psych social worker, reentry nurse will go over what their upcoming appointments are so that the individual has the opportunity to ask questions about what they have to expect upon transition, and then start talking about those basic needs. Where are they gonna get their first meal? Where are they gonna be sleeping at? Maybe the individual doesn't know exactly what all that transitional house, if they're going to transitional living, what's provided for them. Are meals provided? Do they have shared meals? Do they have access to a laundry facility? What does the transportation system look like? I like to use an example of a transitional house. It's on the Pierce County, Thurston County border. It's 2.9 miles away from the nearest bus stop. So if individuals are going there, what are their means of transportation and how are we gonna address that? So if you wanna go to the next slide. Oh, we skipped one, I think. Back up one. Right there, thank you. So how did the reentry navigators come about? In 2015, 2016, the agency received a second chance grant. At that time, that second chance grant, we utilized those funds. It was a $750,000 grant matched by the agency's $750,000. And so we decided as an agency that we were gonna use that funding to not pay for staff positions, but to reach out to community partners and contract with agencies in the community to say, what kind of services are you providing to our population? How do we connect with you to do a warm handoff to these partners? So we piloted this up at Monroe Correctional Facility. At that time, we went into the facility and we said, what is reentry? What does an individualized reentry plan look like? The feedback that we got at that time was, it's your good luck plan. It's $40 gate money and your release address. And that's what reentry was. And so at that time we decided, well, we can do better than this. What is it that you need? So we went up and we started asking the questions. What is it that you need upon transition? And we developed that individualized reentry plan based off working with piloting it through Monroe. We sent that individualized reentry plan out to all of our community partners. We sent it out to all the CPTSs, so Community Partners and Transition Solutions groups, and said, when you're working with this population, what are the things we need to know? What are the questions that we need to ask? And they helped, that's what established or helped us build this individualized reentry plan. At that time, our grant only funded, we had 5 transition specialists. At the time we called them transition specialists, and we had 1 manager. From the work of the navigators during that time, we had some great success, but that grant ended in 2017. And then we continued the work for a couple of years without a lot of structure. So the agency did absorb those positions. And then in was 2018, we decided we need to retake a look and kind of revamp the work that the transition specialists were doing. We started off this grant when we went into Monroe. We pulled RDA lists to identify the population we were going to work with. I think we spent, it was 2 or 3 months pulling these RDA lists to identify the population, but then the counselors were flooding us with referrals saying, I have folks I need to send you, like this person needs that support. And so ultimately, for a couple years, it was just referral based. This individual needs some support. So in 2018, we decided we needed to really put some focus and target the population that we were going to serve with the greatest needs. We needed to build some structure. And so at that time, we pulled back on some of our navigators, and we decided we're going to partner with the graduated reentry population. So if an individual was on GRE, they were also receiving a reentry navigator to assist them and work with them during that time that they were on that partial confinement. And then they also, we could work with them on the front end prior to coming out to schedule those RTNs, and also include that GRE specialist to say, what does this look like? What can you expect while you're out on GRE? We know that's very structured. What does scheduling an outing look like? How much time in the community did they have? And so this allowed for them to ask all those questions that they had prior to scheduling that RTM. So during that time, we also expanded, so we added some additional staff. You can kind of see the timeline. Today, you see we've grown to 30 reentry navigators. You can see over the timeline, we also, back in this beginning of this year, we started targeting reentry centers. So anybody inside their reentry center is assigned a reentry navigator. If they're on CPA, so the Community Parenting Program, they're assigned a navigator. We also have a SIF partnership, so the Strength and Family. Strength and Families adopted our forms, and so they're utilizing the same forms, the same processes. So the only time that we're working with Strength and Families is if there's a handoff. So there's not a SIF case manager in that community they're releasing to, they can hand off to our population. We also established a process for receiving referrals. So as we started adding to staff, we started to build our capacity. We spent this last year traveling the state. We went into every facility and spoke with the counselors, the CPMs, the community program managers, and said, hey, if you have an individual that you're concerned about, maybe they've been down for 10 plus years, maybe they have high mental health, substance abuse issues, and you're concerned because you know they don't have support, they don't know where they're going, they need that extra kind of support, reach out to us, send us a referral and let us know, and let us get an assigned navigator to start working with those individuals. Okay, do you want to go to the next slide? So
That one.
one more back. So what our navigators do? So we also know that navigators, we always say your network is only as large as your network. So we know it's important that navigators work with community partners. In order to be able to connect our population, we need to know what's available, what resources are in the community. So we have our navigators attend some kind of community meeting. So if that's our CPTS meetings, if it's an ESD meeting, what are those community meetings that we can get them involved in so that they know, who's in the community receiving grants, what population are they serving, what services are they providing. We know the documents often go inside the facility, and once they're printed, they're gonna be printed for the next 10 years. And we want people to have real accurate live information that they can utilize. The last thing we wanna do is to give somebody a resource, send them there, and that resource not be available. Our population is very limited resources, transportation is hard, so we wanna make sure that the partners that we're handing off to are actually partners that they'll find value in. They work with individuals on developing that individualized reentry plan. So that individualized reentry plan, when we developed it, there's 3 phases of that plan. We know that when you enter a facility at that reception facility, you might not be thinking of what it's gonna be like when you transition out. You could be sentenced to 20 years. So what's the value of seeing an individualized reentry plan when you come to the reception? We changed those questions to say, okay, what are you gonna do with your time here? What's the programming? What's the resources that you can spend during your stay that's gonna benefit you as you start to begin transitioning out? Then we have that transition phase when people's thinking starts to shift. They're thinking about, maybe they're just thinking about housing that they're gonna transition to. They're not thinking of that permanent long-term housing. They're worried about, where am I even gonna stay? What are these resources? How am I gonna get connected to state and federal benefits? What's gonna be available to me? And then there's that community phase of that IRP. So now they've transitioned out, maybe they've got that first job, but we wanna start thinking about, maybe it was just that first job they're gonna get connected to, but now they're looking at more of a career pathway, that long-term employment. Or maybe I'm gonna start thinking about how I'm gonna get out of this transitional house and get into more of a permanent setting. So we made sure that IRP covers all 3 of those phases. The navigators will work on the essential needs. So on that essential needs release needs survey, we start asking them, have you applied for Apple Health? Do you intend on applying for DSHS food? Where's your next appointment at? What does transportation? Do you have transportation? Do you have the resources to purchase an Orca pass? Are they aware of, how to get a reduced fare, Orca pass or whatever is in there? We know that Orca is not across the state, so what's the transportation system for them? Maybe how are they gonna get to medical appointments? What kind of medical equipment? Do they have medical equipment in the facility, and will that medical equipment follow them when they transfer to the community? What kind of equipment needs to be in that transition homes? We're seeing a growing population of our elderly individuals. Just for an example, one of my navigators was recently working with a 90-year-old man that transitioned. He transferred to a community that was not home for him. So he was not familiar with the area. He has registration or requirements, so that was also a barrier for him. This individual has cancer, so had some appointments that he needed, some very urgent appointments he needed to get to. So that navigator had to, make sure that he had access to a cell phone that didn't have that internet, making sure that he understood when he accessed public transportation, where can I get on this transportation from the house? Making sure that he was avoiding that park or that school in that area. When we scheduled his first primary care appointment, they canceled on him the day of. And so the navigator had to reschedule, knowing that this individual needed an injection immediately. That primary care provider couldn't get him in. The next appointment wasn't for 2 months. So we had to find another location. And then luckily the navigator was with him, because when we took him to that second appointment, it was right next door to an elementary school. So he was able to get the care that day and schedule that appointment, but we immediately needed to change the appointment again to another location. The navigator was able to assist him with getting him an Orca pass for transportation. We able to put in an application so that he could use paratransit for those upcoming medical appointments. But just the standard transportation system was a struggle for him. So putting in application for the shuttle service through Pierce County is a 3-week application process. So our navigator spent the first 3 weeks assisting this individual in getting all those urgent appointments taken care of. So every individual's plan is gonna look a little bit different. Everybody has different challenges. So making sure that the navigator can really focus on that individual's needs. And then making sure that they have the means. So is it, for the GRE population, they may have a blackout period where they can't leave the residence. So do they have food to get them through that first 48 hours, or at least till their DSHS benefits got activated? When they go to that transition house, maybe they don't have the means to go out and go get a bed in a bag because the housing provider doesn't provide it. The navigator can connect with a community partner or access the funds to make sure that they have what they need until they can get that first paycheck. They'll facilitate those reentry team meetings. What that looks like is the navigators will reach into a facility, they send the individual a kiosk themselves and say, hey, this is who I am, this is what I do, I'm gonna send you some forms, I want you to read over these forms, have them completed by your RTN, start preparing some questions that or concerns that you might have. Who else needs to be involved in your reentry planning? And then they'll send a kiosk or an email over to that counselor to identify a date that will work, not only for the counselor, but for all of the other players that are gonna be involved in this individual's reentry planning. And it gives an opportunity to do a face-to-face. It's a virtual call, but it gives the opportunity for them to put faces with the individuals they're gonna be working with. A lot of times we hear that was so helpful, because you get to put a face to who their CCO is. You know who's gonna be there at that other end when they come out. They know that they're gonna have food, or they know they're gonna have clothing and a place to sleep. Maybe that navigator just looked into that housing provider and can give them a little more information on they're gonna have access to. So our navigators also provide assistance with that essential needs, or maybe taking them to those different locations like I shared with the Pierce County situation. Maybe it's not knowing how they're gonna make it to that next appointment, so that navigator can assist them with that, or schedule with another community partner to take care of that. So providing transfer support, so coordinating with that CCO. Maybe that 90-year-old wasn't gonna, if he released from Walla Walla and you're put on a bus and you're supposed to make it to Pierce County, that might not work for a 90-year-old. So coordinating coordinating with the CCO or the CS or the navigator to say, okay, this individual has some mobility, maybe they have some reading challenges, maybe English is not, maybe they don't speak English fluently, so putting them on a bus where they are struggling to read and write, communicate, we may have somebody else pick the individual up and transfer them across the state. Go ahead to the next slide. So these are the different pathways that the navigators are engaging with. So we have the prison to ADHS. We have a navigator assigned to our ADHS facilities. So if an individual is going from a prison institution to ADHS, we have what we call as an RTM1. So our population goes directly to ADHS. Each ADHS, we have one on the east side of the state and on the west side of the state that we contract with. And sometimes they have needs when they arrive there. Normally they have to have a week's worth of clothing. They're not always provided that when you go from an institution with institution clothing. So the navigator may work with them to find out, do you have a family member that's gonna get you the clothing to get through a week? So that for their stay at ADHS. And then our navigator will do RTM2. So on the back end, when they're leaving ADHS, do they know where they're going? Has transitional housing been identified? They'll do that RTM with their local navigator to do a handoff and introduce them to their community navigator in that area and let them know if they need any assistance, that they have that navigator available. We have the prison to reentry center pathway. So our navigators, if they're going to a reentry center, they'll meet with the navigator within 30 days of their arrival. They'll give them another packet. If they're going out on a GRE, they'll give them their GRE handbook so that they can start reading over that during their stay at the reentry center. They'll work with them throughout their stay at the reentry center, and then they'll schedule an RTM on the back end with their corrections specialist to talk about what that second part of GRE, them going out into community or on electronic home monitoring in the community. We have the population that goes directly from prison to EHM. So those individuals normally have a little bit more higher needs because they don't have time to go to a reentry center. They're not already working. They're going directly from the institution to potentially a transition house. And so our navigators will work with them on scheduling an RTM and making sure their needs are met. We have the standard reentry center population. So folks that are not going to electronic home monitoring, our navigators will work with them. Again, as I mentioned, the CPA part population, SIF, and then the prison to community. The prison to community, we don't require that they even have supervision. It's just those folks that we know will have have been referred to us, that a counselor has identified, hey, this person needs some additional assistance, and has been referred to us. So those are our pathways, and then we also we partner with health services, education, contract providers, classification groups. We may partner with our VA partners. So if they're have been identified as a veteran, we have a contact with the WDVA and Veterans Healthcare on the call with them. So if it's kind of that specialized population, we'll make sure that we have our partners on to talk about what kind of benefits they can access through the VA or through tribal. So making sure that we're partnering with our partners. All right, go ahead, go to the next slide. In front of you is a graph. This I just pulled this last week. You can kind of see the population that we served as of last week. Our 30 navigators, you can see we're serving just over, I believe, 1,100 individuals. So the caseloads kind of vary depending on the location or the assignment of the navigator. If assignment, the navigator is covering a reentry center, just for an example, currently I think Longview has about 90 individuals or 90 residents at that facility. So that navigator is working with all of those individuals currently. So she spends part of her time at the reentry center. She's also working with some of our ADHS population. So some of our workloads are a little bit higher than others. So I have a Pierce County navigator, since I have 2 in Pierce County. One is covering my reentry center, and her numbers tend to be a little bit higher since she covers the reentry center versus my other navigator that does the majority of the community work, but that community work means that he's catching all the other referrals, or those individuals going directly from institution to EHM. So his numbers may be a little bit lower, but the need seems to be a little bit higher. 7 continuums for each one of those pathways to help kind of show the work that the navigators are doing and at what touch points. This continuum that I'm sharing is just the standard continuum showing in 3 different phases. We have that facility phase, the transition when folks start to focus on their transition out of the facilities, and then the community phase. All right, go ahead and go to the next slide. Here's a map of Washington State. As you can see, those are our different regions, the sections. We currently have 3 CS4s. Our CS4s, they work kind of behind the scenes. They support our navigators. They do all of the assignments. They manage our inbox, so our referral box. So anytime a counselor reaches in and says, hey, I have an individual that has concerns, they'll coordinate with that counselor to get the individualized reentry plan, a release needs survey. They'll identify the navigator in the individual's local area to send that referral over to the navigator. They pull all of our data for the team. Go ahead and go to the next slide. Here's our 30 navigators across the state. You can kind of see that our navigators, their area of coverage, the facilities they're assigned to. You can see that some navigators are assigned more than one facility. So like Rochelle Warner is up on the peninsula. She has a very large area and she covers three facilities. So Stafford Creek, the Olympic Correction Center, and Clallam Bay. But we seem to have less numbers going out to that area, so she'll cover a larger facility or larger coverage area. All right, next slide. That's all I have, unless anybody has any questions for me.
So, Misty, I first and foremost, I just wanted to say thank you for being here and sharing this information with the CI Advisory Committee. I think it's important to for everybody to understand kind of that cross section and intersection between the reentry navigational services and correctional industries, because we recognize that the population that we serve, which is about 1,700 incarcerated individuals, you know, the vast majority of those are releasing. And while our focus is on, soft skill, hard skill development inside the facility, for the committee members, we do have 3 navigators within correctional industries. So one of them is a community employment specialist, and the other 2 are navigators really located inside the prisons that really are focused on soft skill development, as well as some other additional opportunities such as employment, as well as resume building. And so there is that cross section of knowledge that there's that handoff from our navigators that are in regular communication with your navigators. And while I know 30 isn't enough, for us 3 isn't enough, you know, for us either. So, but there's just significant value in that baseline understanding of the work that, as you talk about the continuum of care model, that, you know, our focus is that inside the facilities, development and support, and then, like I said, we have a singular community employment specialist that really focuses on post-release employment opportunities. So I just wanted to share that with the committee, and again, thank you for presenting today. So is there any questions from the committee? Yeah, Representative Fossey.
Thank you so much. This was very, very fascinating. I did put my LA's email in the chat. I'm hoping that you can send that over to them. It was a really, really great overview. I had saw that the numbers of served and referrals was 1175, and then there was 772 completed. I was wondering if you could explain who were the people that did not complete, and what, if you knew the reasoning with that group, and then if you knew the demographics of that group.
So the 700 completed, that was probably just a snapshot of that week. So our navigators will work with them probably 30 to 60 days prior to transitioning out to the community. And then once they transition to the community, the the navigators will close them out, dependent on the individual's needs. And so we'll start taking a look at either 30 days to, we say 90 on average, but we have some folks that the navigator may stay involved in for, up to 6 months, depending on their needs. But we try to target them at that 30 to 90 days to say, okay, did we hand them off to a community partner? Have the navigators met 90% of the identified needs in their individualized reentry plan? And we will close them out, and that is a completed individual. I don't have the demographics in front of me, but I can get those for the population that we served last year.
So the sheets that were mailed out had said that 772 of those total individuals for the fiscal year 2023. So 1175 were referred for reentry navigation services. 772 of those individuals completed reentry navigation services.
Gotcha. So
And then it goes into the details of,
So those could be an individual maybe denied services. So we're figuring about a third of the population will say, maybe if they're in a reentry center, I don't need navigation services. Maybe they're going home to a family support, they didn't have any identified essential needs, so those could have been closed out as no navigation services or denied services. It could be somebody went in and violated and went back into the facility. That would have been incomplete, so we have some different program statuses, so I can get a breakdown of what those closeout statuses were.
I would love that if you could send that to me. I'm really curious if that's kind of that group that is not completing the services, if it is simply because it's not a need for them, or if there's some sort of barrier in the way that they may need some additional assistance. And the 30 to 90 day window, is there a reason why we're not looking at this earlier and having touches, prior, earlier on with folks?
Capacity, we don't have enough navigators, especially when you look at the reentry center population. We recently expanded the reentry center population from 6 months to a year. So folks are staying in reentry centers longer. We also, when they go out under graduated reentry, they can be out on graduated reentry from 12 to 18, or up to 12 months. And so a navigator doesn't have capacity to hang on to folks for 12 months during their entire stay out on electronic home monitoring. And so with the 30 navigators across the state, to keep numbers at a manageable number and provide quality services, we've got to be able to close them out.
Okay. And given the capacity, approximately how much time is the minimum that an incarcerated individual will spend with a reentry navigator?
A minimum amount of time?
Yeah, you said there's team meetings and other things that happen. I guess maybe give me an average.
So I'm gonna say on average, the navigators probably engage with them at least 4 months.
Is that like an hour a day?
I don't know if I have a breakdown of those numbers. I might have to get back to you on that.
Okay, yeah, I was just wondering if it's something where they track them and it's like a once a month type of session, or if it's a long-term involvement, how much kind of what that snapshot looks like for the individual.
It's probably
That would be.
Sorry, I was gonna say, it's probably gonna look a little bit different for each individual, because you've got that pre-work planning, just scheduled for the RTM, all the coordinating with the folks attending that RTM, preparing those documents, the time on the RTMs, those are always, at least, we try to keep them under 30 minutes to be, because we gotta be respectful of those inside the facility at their time as well, and for their assistance in helping coordinate those calls. And then providing that data transfer. So what does that data transfer? Sometimes those transfer day supports can be an all-day thing. Do they need to go to DSHS? Do they need to go to DOL because they transitioned out with an ID card? Do they need to go to the Social Security office? And then follow-upping, we know that in those first week, so that 72 hours is the most critical time frame. So the navigators, it's important that they kind of, that first week, hey, how are you doing? Were you able to make your next appointment? And then as the individual starts getting connected to services, they'll cut back. And at that point, we say, once you get to that point of minimum monthly contact, we need to start considering what's the value and are they ready to close out?
Gotcha. Okay. Just two more quick questions. I know that you had mentioned the folder that you had modeled after the federal level with the reentry plans and the SMART goals checklist. Is there a way I could get a example of what that looks like?
Yeah.
Sent to me? That would be really, really interesting. And then lastly, of all this wonderful work that you do, is there what would you say kind of is your measure of success, like data wise? What do you kind of look at as, this is how we see that this program is being successful, and in reviewing your practices of what could be helping more folks going forward.
That's been tough for our team. We have metrics that we pull. Our metrics that we're currently pulling has the individual completed a transition. We broke that IRP down into 2 phases. A transition IRP, what's the completion rate of that? Did we schedule the RTM for the individual prior to transitioning out? Did we get that release needs survey? Did we provide transfer day support? And then we want them to complete that community IRP. So prior to closing them out, what services, did we provide that community IRP? And to close them out, we want to make sure that we're meeting 90% of those identified goals or barriers that they have identified in that plan. But when you're looking at success, there's so many smaller successes in there. It's not just that, we like to say it's not just checking that box saying it was done. It was all of those line items in there. What were those barriers for that individual and did we reach them? So we don't have a way to accurately capture that other than saying that these items we checked off.
Gotcha. And is there a follow-up on that data that you collect after you close them out, following up, seeing where they're at 6 months, year from there?
We don't.
Okay. Thank you.
Senator Wilson?
Thanks. I just wanted to say, Rep. Fossey, let's chat. I think one of the things that is really important is that as a legislature, we've never funded the things that you're asking about. And as a matter of fact, I think there are very few individuals that are actually releasing that have access to reentry services. I think there's perhaps a belief that that's something that's available to all. And it's not. It's only those that are in partial confinement, I believe, that actually have access. So the kinds of things you're talking about are exactly the kinds of things we need to put our resources behind. And it's not always necessarily about adding more people, but really looking, I think, also at the resources that are available to those individuals, the length of time, pre-release. We made a change around the healthcare with Medicaid, and that was 1115 waiver, which is a huge federal push. So would love to work together on a lot of these things, because we, I believe, as a legislature over many years have not actually funded folks to be successful in their reentry as much as we've funded people to stay exactly where they are, and that's just coming from myself as a human, but as Chair of Human Services, really important that if we want folks to be successful, we need to support them in their successful reentry as they are leaving facilities, regardless of how long they've been there. So I am really looking forward to working with you on this one. So and appreciate the information shared today. Hopefully I didn't speak out of turn, but thanks so much.
Absolutely, thank you. Terry Fortner?
Hi, good morning. Thanks for all of the great information. First of all, there's some really great comments and points and questions being asked in the chats, and I know that our DOC team doesn't respond to those in real time during the meetings, correct? But there will be follow up to those.
That is correct. Thank you. Yes.
Just for some of our newer members who maybe don't know the process, that maybe would be a good thing because there are some good points being made. So thank you for that. And then I just wanted to be sure that I understand clearly that the navigators are functioning internal to the Department of Corrections, meaning that they are housed within facilities at this time.
So from a correctional industry standpoint, we have 3 navigators. One is a community employment specialist. She's located in the community. We have 2 correctional industries navigators, and their functions are really working with those individuals that are participating in the various correctional industries work training programs throughout the states. They are located inside facilities. As far as the reentry navigators, I'll let Misty respond to that.
So we currently have
Thank you.
We currently have 2 facility navigators. We just put one this last year into Shelton, and then we have one out at Walla Walla. Their positions look a little bit different than the other navigators. So we're looking at doing some reentry curriculum. There's a Pine unit out at Shelton. They just established that one. It's about half full. And so my navigator there at Shelton will identify those that are getting ready to transition out, working on those individual reentry plans. He's working on coordinating an in-person resource event to bring those providers in to speak to some of those barriers. And then we'll hand them off to community navigators.
Okay, and the community, so are those technically like pilot programs, and then we're looking to have those expanded? I mean, I believe that I'm still the only representative from Eastern Washington who sits with this committee, and I'm just really curious as to what that looks like in the future. And then I wanted to add another piece to that is the organization that I currently work for is we tout ourselves, we are wraparound services, and there could be an opportunity in the future to have some sort of a navigator that is housed within, our facility, which of course we're a food bank, diaper bank, clothing bank, emergency resources, homeless outreach. We have, housing specialists for other community and nonprofits that are under our roof. So I would be really interested in seeing kind of if there is something, what that overall plan, and then seeing how I can in turn be an advocate in Eastern Washington for the growth and expansion of that. So, and I'll mute myself. Thank you.
No, I think that's really, really great feedback, Terry, and I think that's an opportunity for Misty and her team to connect with your organization, because the reentry navigators, they are DOC staff. They're located in the communities, but as Misty talked about, they do connect with the local community at large, and it sounds like your organization might be one that again that would be very important that we make those connections with.
Correct, and I didn't catch the organization she was with.
What's the name of your current organization?
So I work for Spokane Valley Partners, which is becoming Partners Inland Northwest. And one of the things that I work on consistently is, as the Director of Philanthropy and Communications, is trying to figure out how I can share what it is that we provide with these different populations. And so every week I'm kind of consistently surprised by the number of organizations that are popping up in specifically the Spokane Inland Northwest region who are seeking to assist formerly incarcerated individuals navigate kind of that reentry into society and community. And so we of course provide a number of things for them to help them along their way. I mean, while they're looking for jobs and they're looking for places to rent, we can provide for some of those other basic needs and also help connect them to other community resources. And I'm always willing to have a conversation with whomever about how we can work smarter together to, again, to advocate and to create these opportunities for specifically these formerly incarcerated individuals who are releasing into our communities.
Perfect. I'll have to connect with you. We do have 3 navigators over in that area. And so one of our navigators in that area is a facilitator of the Community Partners and Transition services over there as well. So a community meeting that focuses on our population, so it might be a good meeting for you to attend as well.
Wonderful. Yes, thank you. Thank you again for all of the wonderful questions and engagement. At this time, we'll move into the divisional updates. And again, for those of you that are new to attending the CI Advisory Committee meeting, this is the opportunity for the leadership team over the various operations within correctional industries just to give a high-level report out on the last quarter and how each operation is going. So with that being said, we will start with Braille.
Thank you, Jamie. So Braille, located at WCCW, completed about just over 100,000 Braille pages in this last quarter. It's been extremely busy for them, and most recently they've actually completed a few extended shifts to assist in that workload. One of the things that is creating that additional workload is staffing shortages at Ogden School for the Blind, which is resulting in our senior transcribers needing to proof all the material prior to publication. Continue to focus on increasing the incarcerated individuals that are participating in that program. Glenn Davis, our general manager there, has been coordinating with the facility to provide some informative tours to prospective individuals that are interested both in ProCAD, our design services program, and Braille, which are located adjacent to each other. And then I continue on with our computer-aided design. So it is a bit of a slower period of time for CAD. However, that gives us additional time to really focus on the quality and the training, cross-training that we're able to provide the individuals. We received 33 new drafting jobs in the third quarter. The finalized total of those jobs is just over $280,000. So each individual is created also, it's been kind of a fun project, a little bit of competition amongst the women in that program, is we are working on a new design and updating our front desk area here at CI headquarters. And so we worked with them, gave them some parameters and let their creativity flow. And it was pretty neat to watch when we announced who was the front runner in that, and just the women supporting each other. Is actually one of our least experienced drafters that have the best, determined to have the preferred design going forward. I'm not going to say the best.
Okay. So next, just moving into food manufacturing. So a brief update on food manufacturing. The picture that you're looking at is on the left. You see some individuals that are working in the food factory at Airway Heights, producing some of the burritos that are served on food services as well as sold to external entities. The picture on the right is the from scratch made calzones. That is a fairly new product developed at the food manufacturing operation. Again, that's served only internal to DOC. So food manufacturing, really the biggest struggle that we've had there over the last quarter has been the availability of the incarcerated workers to get the work done. So again, our programs exist on a voluntary basis for those, but that facility is located at Airway Heights, which at Airway Heights is our largest CI presence. At any given time, we generally have about 400 to 500 incarcerated workers at Airway Heights, between 6 or 7 different areas and lines of business. But Airway Heights Food Manufacturing, they continue, it's a 5-day-a-week operation. They continue to produce a significant amount of food, both for internal DOC use, but about 30% of the food that they produce is sold externally. Again, and the external customers are gonna be local county jails, as well as senior Meals on Wheels programs, as well as other state entities outside of Washington State. Food manufacturing is next in line with our IT project. So again, we have a significant IT project going on within Correctional Industries, which is replacing our MRP system, our Material Resource Planning system. So that system is integrated with all of our financials and building our manufacturing builds and materials. And so everything we do is interconnected to this system. So in addition to the daily work, there is a lot of time commitment going into the food manufacturing staff focusing on the new IT software. So food services, again, we just continue to serve, roughly 36,000 meals a day. The food system continues to update quarterly menus. They produce a quarterly newsletter to the incarcerated population. Recently, of course, they just had the Thanksgiving meal, and now preparations are underway for the Christmas meal that's going to be served. The Department of Corrections has hired a new state dietitian, and so that position is integral, working with the Department of Corrections food service administrator on necessary needs for religious diets as well as medical diets. And so those meetings continue, and the new dietitian has already provided valuable leadership from the Health Services Department to food services.
So moving on to furniture branded sales, just to highlight the photo that was shown there on the slide. This is actually the new reentry center in Wenatchee. It's the first reentry center to be, started in 20 years. So it's a pretty exciting time. Our account executives work very closely with the department's project team to identify light, bright, welcoming furnishings to make it a very nice environment for those individuals that are transitioning out. That facility will be able to help in the transition of up to 120 individuals to that reentry center. As far as the branded sales, though, we have identified a new flagship chair that is going to be replacing the Stratus. The Stratus chair has been with CI for a long time. It was developed within our operations through sourcing different components from many vendors, and it has become extremely not cost effective to continue with that, just with sometimes availability of the products and then also not be able to always source those items. So we will be looking at discontinuing the Stratus chair as an option in January, and we've identified a replacement for that. That will become our new flagship desk task seating chair. Another kind of really cool project that we've partnered with this agency previously as a non-mandated customer is the Yakima Housing Authority. So Yakima Housing Authority has decided to continue that partnership, and we are currently working on I believe it's a 54 unit housing structure for low and moderate income individuals that will have studio and 1 and 2 bedroom apartments. So it's great that they want to continue that partnership with us, and we can support them in their goals. So furniture manufacturing, it's a really great year for the furniture division, and one of the positive outcomes for that is that we were able to receive approval to purchase new equipment. So some of that new equipment is a new Contour Edge Bander, one of our drilling and routing CNC machines, and a straight line automated CNC Edge Bander for our wood shop. The old machines continue to break down, resulting in production delays. There's ended up being some quality concerns. We also want to ensure that as these individuals are receiving this training, that the training that they're receiving is relevant to some of the equipment that they'll be potentially asked to operate upon release, right? And so if they're working on 20, 30-year-old equipment that might be outdated, it doesn't really, it gives them a foundation, but it's not going to help them be as competitive as if they're working on the most available technologies. So we're excited to get that approval, and we expect that equipment to be fully delivered, installed, and operational here hopefully within the next 3 to 4 months.
Good morning, everyone. I'm going to report out on incarcerated individual services. So this is our commissary, centralized commissary operation, as well as our package programs, both food and monthly property programs. The photo on the screen is the carts at Airway Heights Correction Center with commissary bags, orders on them. So commissary has seen an increase in commissary sales. For those who were on our September call, recall that we the Senate Bill 5131, which created the deduction-free sub account for commissary, was implemented in late July. And so over the course of the last several months, we have seen a fairly significant increase in commissary sales due to that availability of funding that family members are providing to their incarcerated individuals. And so that has so far gone smoothly. There hasn't been any disruptions or any significant out of stock or anything like that that's occurred because of that increase, but it was a noticeable increase in sales. The facilities are correctional or incarcerated services and package programs are both doing Making It Work classes with our staff or instructors, and so we've gone through quite a bit of training opportunities for those individuals in those shops. And just recently, in regards to the package program, the property package, there was changes to the policy 440000 in the allowable items, and so recent property sales have added some new property items to the available items for all incarcerated individuals statewide, both in male and female facilities. So we've seen some increase in those programs as well.
All right, good morning. It's my opportunity to report out on laundry. In the first quarter, first fiscal quarter, July through September, we have processed 2.8 million pounds of laundry. We did 2.6 million pounds of laundry a year ago in the same period, so just a slight uptick. One of our major accomplishments for the laundries is having a new ventilation duct work taken care of at the Washington Correction Center in Shelton. That occurred back in September. This improved efficiency of the operation of the equipment there to allow for lower drying times and improved cool down times, and also, of course, reduces the risk of fire danger as well. We continue to maintain 100% staffing levels across all the state facilities for those critical positions, and we continue to focus on training our staff and our workforce to provide consistent operations across the state. So what you want is that the laundry service to be consistent between each facility, so there's not any change in service there. We're happy to report that we have had 14 individuals receive their Association for Linen Management certificates, as well as 10 others receive their Standard Occupational Code certificates during the same time period. The next section is license plates that I will report out on. The picture that you see here is of our new facility operation plant at Washington State Penitentiary. License plates will remain at the penitentiary to be produced, however, in a different location now, much larger area for us to produce in, and we're very excited. We anticipate being fully operational in there next month. And so there's a lot of activity there right now. As we're working to transition to that area, we do continue production of license plates in the current operation. That's still been very challenging with the limited number of incarcerated workers that we have out in that area. We have coordinated with vendors and suppliers in order to meet the needs of the Department of Licensing, but moving into this new location will definitely help us get back on track and stay up with the demand with their orders. We have received all of the equipment. It is all now installed, And we're in the process now of having some finishing construction work to take place to button that area up to have it meet inspection requirements by the state and by the fire marshal. Those inspections will take place over the course of the next couple of weeks, and now we're just rounding out with the IT portion of that project to bring everything online. And one of the really exciting things about this is that the equipment is much more technically advanced and will provide much more usable work skills beyond what we currently have to offer in our current plant. In regards to tabs, we have that operation at the Monroe Correctional Complex. They continue to produce well up there. They're meeting the priorities of the Department of Licensing, and in that area we are also seeing a much improved supply chain this year compared to where we were a year ago. So appreciate the work that's happening up there. I'll speak a little bit more on the new shop when we get into the next section of our meeting, but that's what I have to report out on license plates at this time. Thank you.
On the McNeil Island Stewardship, so starting with Marine, we received funding in the last session for pre-design for replacement of our barges and a passenger ferry. This is going to take quite a bit of coordination with capital projects, procurement, contracts, and the Marine team right now is identifying the specs that are needed for both of those replacements. The barges for McNeil are fairly unique in that they have a bowed front, so you can't just pick one up used or that's like mass produced. Not mass produced, I don't think any barges are mass produced, but that are regularly produced, so it's gonna take a little bit of work. They're also planning for the dry docking in 2024 for the passenger vessels Callahan and Chinook. The rail system for dry docking at McNeil is still deemed unsafe, and no funding has been provided to replace or to repair that. So we will continue to dry dock up in Port Townsend. On the island ops side, the picture gives a great representation for it. We were able to establish an electrician position in last year, and that position has been filled, and that individual has been extremely busy providing some updating for some low energy lighting upgrades throughout the island. That's a picture of the main dock on the island and Causeway. There's been numerous concerns over the past few years around just the safety aspect of slip strips and falls due to poor lighting, and so if you're on the Stolcombe side, it's very easy to identify McNeil Island now, especially at the nighttime. On the wastewater operations, grant package was submitted in October, which will hopefully provide funding for a feasibility study of turning our wastewater plant into an outfall system into a loss system, which is a large on-site septic system, essentially. I think there's some great advantages with that. One, we're not distributing water directly into the system. It'll go and filter additionally through the ground like a home septic system. So hopefully we get approved for that grant. And then the operations continue to stay busy. McNeil is a bit of a challenge any day, but especially during winter months. So the teams, both in Marine and on the island operations, are planning for winter incidents, whether it's windstorms, power losses, king tides, those sort of things. And so preparing for supplies, contingency planning is ongoing throughout the winter, and that's our focus at this time. Thank you.
Good morning, everybody. Airway Heights Optical Division is out of Airway Heights Correctional Facility in Eastern Washington. We have 59 individuals that participate in that program and currently 6 vacancies. Over the last quarter, we've issued 18 certificates of proficiency. So as the individuals gain the skills they need and the hours in their current certification, then they're able to gain certificates of proficiencies in the current areas. Airway Heights currently and assist the Northwest Region Lions Club Eyeglass Recycle Center. It's an opportunity for individuals to give back to the community where they sort, clean, neutralize, and catalog used eyewear for recycling. Over the last few months, we're working with our vendors and partners on adding 52 new styles of eyewear and retiring 28 old styles in partnership with Washington Health Authority and maintaining the same pricing, so with no additional cost incurred to our clients. We do expect for the catalog to be, out the beginning of January and offering those new styles to individuals.
All right, our next section is risk and safety management. Just having a technical issue here for a minute advancing the slides, but in regards to safety and risk management for the facilities, in the month of October, that was the last safety audit for 2023 for all of the facilities. It's great that we're able to get out there again now and get those audits done, whereas there had been a pause during the COVID period as far as being able to get out into each facility and do a thorough audit of the areas. We continue to provide monthly safety reports to the facilities in regards to accidents and any near misses and things of that nature. What's been very nice to see that is over the last 3 months, we have seen a 50% decrease in accidents at our facilities. I think a lot of that goes to just, again, having it as a discussion point, having our regular safety meetings, and being consistent in the messaging around safety and putting a focus back on it. Our priorities will continue to be making sure that we're conducting our safety meetings, that we're reporting any hazards that we might see, and building a culture around working in a safe environment consistently.
So moving on to service and delivery. Year-end numbers for furniture projects were far exceeded expectations of what we had forecasted, and the installation teams were a bit overwhelmed. So at the time of this information gathering, there were about 100 install orders yet to be finalized. Product was here, it was at customers' warehouses, but we just didn't have the capacity in our numbers to finalize those installations. Those are now currently at about 30. About half of them are due to customer request a delay because of their own project needs. So we'll continue to work with them to get those projects finalized and get those scheduled. We have been able, within the service and delivery division, to source and receive some new vehicle assets. With some of our box trucks, we're exceeding 325,000 miles. The costs in repair and breakdowns were definitely becoming an impact. So it was really great that we were able to get a full replacement, replace a cab chassis, and then also do some motor replacements to extend the life of some of the other ones. We continue to focus on worker numbers and getting those individuals enthused about being part of our program here. And we're just about where we'd like to be, which is between 35 and 40, both for service and delivery and within our CDC, Consolidated Distribution Center, to support the operations here. Thank you.
Our next section, textiles. Biggest accomplishment for that area, and it'll be spoke on a little bit more here in a bit, is moving into our Microsoft Dynamics D365 program, what Jamie spoke of earlier, changing over to a new MRP system after close to 20 years. It's been a major accomplishment. It's been definitely interesting and challenging. The interesting part about textiles is that we have 5 different locations, and now being able to have all 5 of those connected, for being able to do reporting and real-time review of inventory and all of those activities has been very beneficial. Like I said, it has come with its share of challenges as well. One of the interesting things about this too is that not just learning the system, but it's also reshaping how we do business and how we're able to integrate different areas and communicate with one another and communicate with our customers. So we're definitely seeing the benefits and getting over some of the obstacles that we've had so far, but feeling very positive about moving in this direction. We have added some new vendors. One of the areas that we have been focusing on is finding a solid female workwear vendor. And we've been able to do that and provide links to our websites for our different partners in the different agencies that are needing female workwear. And so it's been great to bring that on board. We've also been able to work on different vendors across janitorial supplies and improve price points. And one of the big things that we've done is we've been able to work with the Office of Minority and Women's Business Enterprises, AWAMBI, to add some additional vendors that work more with smaller vendors that can supply items to us and still meet our needs and our procurement standards. And we've been able to find those in the janitorial realm and also in some of our paper products as well. So it's an exciting time to be able to involve those folks and to continue to have those conversations with different women, minority, and veteran-owned businesses and bring them more into the fold. And those businesses, just as a by the way, are also Washington businesses, so that money stays within the state and hopefully is a benefit to everyone.
You want me to talk? Track report?
Yeah.
I can do that. Well, we've been really busy, myself and Mr. O'Boyle and some of our community partners. We graduated that class 65 from Michigan State and have some graduates out there doing really, really well. The woman who is in the cement masons and plasterers is being very successful right now. We're really proud of her. We graduated the Manufacturing Academy class number 6 with 16 students, I believe. And we've really had good success with that. We've actually have a couple of them. We've partnered with Pioneer Human Services. It's probably not in this report, but they've done a 3-week Roadmaps for Success program, and all of them have become employed with various employers through that program with their AJAC Manufacturing Academy credentials. So that's worked out really, really well. We have one in Spokane doing Roadmaps for Success starting in the next class. She just went to Eleanor Chase Work Release last week. Already got her enrolled in that program, and so she'll be moving forward really quick. Expect to have her employed by first of the year, I suppose. So something like that, really good. The next class at WCCW, Manufacturing Academy, is scheduled to start in early January. I have 20 approved applications for that, so that class will be full. It's really great. We're bringing an instructor in 3 days a week who will be teaching that class in person. He'll be getting his contractor yellow badge next week at WCCW, so that's really good. So we're moving more toward that in-person model, so hopefully we can work with Airway Heights a little bit better and have some more capacity to expand that training. Really good. Our grant from WSDOT is doing wonderful. We have 60 people signed up for flaggers next week at Stafford Creek. I'm sure some of them work in different CI shops, the CTAP program that we work there, so that's super. And then we're working with Shelton WCC. There will be a class there in January, Flagger certificate, and we'll be covering the cost for that. So through the grant, like I said, that's going really good. And actually, in our strategic Priorities, we have in there working with a new to offer forklift training to some of the re-entry centers. I believe our first class is Saturday. We have 11 people signed up for that, that we're able to fund the training costs for that also. So really good, and maybe in the workforce development report out, I'll steal a little bit of thunder there, but working with our partners, the Urban League of Metropolitan in Seattle, we've been able to get a couple CI people into their next program that have released, working with our community partners and all that. So, but yeah, that's good. We're continuing to work closely with Lindsay's team in developing some new strategies to apply some of those SOC certificates and maybe create some more easier pathways to follow, for folks getting out of CI and moving into apprenticeable positions. So, there you go.
Thank you, Steve.
All right, I'll tag right along and talk about workforce development a little bit. The photo on the screen is Mimi Jansen. She is our new, I think we announced her at the September meeting. She's been with us about almost 3 months now. She's our mission and brand administrator. And recently she attended the Greater Spokane Meet the Bigs event. This was actually her second week in a row in Spokane. First week she was meeting with the chambers, the various chambers of commerce in the area. So really working to engage with the local communities, build partnerships with the members of these chambers of commerce to learn about becoming second chance employers and how CI can assist and they can work with us or with our workforce development employment specialist in maybe finding opportunities for individuals post-release for employment. So that's been going really great. Some other things going on in the workforce development world. We've resumed our Job Hunter series back in May and have now held the Job Hunter course at all facilities. We are also working on a financial literacy course. We had a financial literacy course pre-COVID and are working to bring that back with the hopes to launch that again in January of 2024. So basic, how to plan with your savings, how to take the money you're earning in work and appropriately plan for the use throughout the month or longer. So that course we'll hope to start beginning of the new year. And then lastly, cognitive coaching has resumed. So cognitive coaching is a one-day training for CI staff to attend. It explores the different cognitive behavioral patterns for helping incarcerated individuals find success, both while they're working inside in our operations and also for their success after they release. So that training resumed for staff in August of 2023 with hopes of getting all staff either trained or retrained, because this is a course we've previously conducted, but training and retraining all staff by the end of the current fiscal year. So somewhere June 30, having all staff attend the cognitive coaching training. So that is all I have on workforce development.
Perfect. Thank you for that, Lindsay. And before we get into the question and answer portion of any of the operational report outs that we just went through, we have entered the public portion of today's meeting. And so just wanted to take a couple minutes and see if there was anybody from the public that wanted to address the committee. Kaylani?
Thank you very much. One of the things that I really wanted to come here today, and I was able to make some time, was to share with the committee of my thoughts of how someone is actually able to be part of the committee. The way that I was understanding the law, the RCW, of how this committee is formed, there is no actual language that states that the department can actually ask individuals that are applying for the position on the committee to supply with resumes. It's a little for me, it was a little intimidating as to why I would have to share my experience to be able to sit on a committee that my husband is incarcerated, and I feel passionate about this, that I want to be a part of something like this. I think that the committee needs to know this, that it's not right through my lens. It also can cause room for discrimination. I also was sent a letter by the committee basically denying me being part of the committee, and the way that the letter was formed was really, it was really degrading, to be honest. And I feel the committee needs to know this, and I hope that in the future that can change, because 3 family members now have applied for the position and they all have been denied. And it doesn't actually state on the website, nor does it state on the RCW that forms this committee, that the DOC is the one that makes the decisions on who sits on the committee. Thank you.
Thank you for sharing that feedback, Kehlani. Is there any additional questions? No. Okay. I don't see any other hands up from anybody in the general public, so please notate in the minutes that we'll resume the business meeting at 10:28. Thank you. So as we before we entered the public comment of today's meeting, we had the operational report outs. I just wanted to open it up for any committee members. If there was any questions, I know it's a lot to go through as we have a lot of lines of business, but just to see if there was any questions from anybody on the committee. Senator Wilson?
I just had a question, and you don't have to have an answer, but I'd love to know. I noted that WCCW had the apprenticeship program, and just curious if any other facilities that serve women have any of the industries that you shared, from commissary to the other, and just am curious, just in my own learning, if that's something that someone could share with me via email or whatever. You don't even have to do it now, but
Yeah.
Just a curiosity I have.
Okay, perfect. Yeah, I can just answer that quickly, and then we can also share materials after the meeting. So yeah, WCCW as the women's facility has had the AJAC program as well as the TRAC program. Those have been long tenured programs there. In addition to that, other correctional industries programs located at WCCW is we have a textiles operation which does screen printing and embroidery, and then that's also where our ProCAD operation is located. So those are the women that do all of the drafting and the drawings. So everything in the furniture division really stems through WCCW for projects to be completed. So the women are actually drafting all of the various projects, everything from one small office reconfigure to working on mass University of Washington projects.
So the reports that you all just did were really just kind of high level. I just noted institutions underneath and made an assumption then that that's the only place that they occurred. So that's not necessarily been the case. So some of the things you just described were not things that were, and this is my first meeting, so I apologize. I'm just trying to get up to speed.
Oh yeah, no, it's absolutely, and we have a map that we can send you after the meeting, which shows every line of business within each institution. Yeah.
I am a visual person. That would be absolutely the best. Thanks so much.
Perfect. Okay. Any other questions on the operational report outs? Okay. Great. So moving into the new business portion of today's meeting. So I just wanted to highlight some of the work that we've been working on behind the scenes. So again, with correctional industries, I think everybody on the committee recognizes that that we have a revolving fund. So therefore, you know, when we purchase new equipment, it's purchased out of funds that are received from the revenues we generate. We don't receive appropriated funding except for the small appropriation from the stewardship of McNeil Island. So our goal in correctional industries is to continue to create and maintain sustainable work programs inside the facilities that are really teaching those hard skills and soft skills for the incarcerated population we serve. So with that in mind, we are continuing to collaborate and really integrate ourselves. And one of the areas that we want to focus on is education. We know statistically individuals that receive, education or other job skills are at a higher rate of success for post-release employment and recidivism. And so there's a project that myself and the education administrator, Kristen Morgan, and the chief of dentistry, Dr. McDaniel, have been working on, and it's the potential of a new program that would be really a joint venture between all of those three operations. And so what we're looking at doing is creating it's called CDT, a Certified Denture Technician program. So, we're very much in the infancy stages. We have had an opportunity to tour a few facilities around the country. Right now, I believe there's only 5 programs in the United States that even have a CDT program. And of all of the 3 programs that we visited, so one was in California, one was in Florida, the other was in Ohio. Of those programs in the history that they've been operating, which is mostly over 30 years, they average a 0 to 1% recidivism rate. And part of that is because of I believe the skill set that the individuals are gaining while incarcerated, combined with post-release employment opportunities, livable wages, really creates beneficial opportunities. Again, we're very much in the infancy stages of developing this program. And again, we're looking at that this could create a pathway for partnering with a local technical community college where somebody, while working in a correctional industries program, is actually gaining an associate's degree with a future pathway to a bachelor's degree, while the work that they're doing, creating the dentures, in various cases on the work training program is actually benefiting the incarcerated population themselves that we serve. So I just wanted to bring this to light with the advisory committee for an awareness. We're still in the stages of having these conversations with DOC leadership and presentations on a potential opportunity. So I'll pause there and just see if there's any questions from advisory committee members about this potential program. Yeah, Representative Fossey?
Thank you. It's really interesting to learn about the collaboration. I remember hearing about this a little bit ago. Fascinating. With the Certified Denture Technician program, is the goal to have folks, when they re-enter, leave and go to one of these 5 areas in the U.S., or what would...
Yeah, so the goal is that they would release directly with employment and into one of many labs. So all states have quite a variety of denture labs, private owned or otherwise. And so it is one of those in our research and data search with ESD, in terms of it is a necessary growing area of need, just in terms of employment in general. And so the credentialing of actually obtaining a CDT is at a higher level certification. And so the ability to gain employment with, a variety of private sector stakeholders, there's significant opportunity. When we were down in Florida and Ohio, the individuals that are releasing from those programs, they're being released with competing offers for employment opportunities while still incarcerated. So like I said, we've just seen a really high success rate from those other programs.
Amazing. Would you have just data and numbers that you could send over to my office about the anticipated workforce needs in Washington? So I'm totally unfamiliar with this industry, but that sounds like that could be very helpful. It might kind of help me understand what the process is for when you're pursuing new partnerships in the future for these types of programs.
Absolutely. Yep. We will follow up with you on that.
Thank you so much.
Yeah. Okay, and then also with today's materials, we did send out, so we've wrapped up the fiscal year 2023 annual report. So we did send that out, which just highlights kind of the year snapshot. In addition to that, we always maintain a fact sheet on CI, so we did send that out as well. And that kind of looks like, I know it's in the slide, Sarah's going back to it. It was at the beginning of the presentation, but just a few highlights from that, from differences from fiscal year 22 to fiscal year 23. We did see an increase of participants from correctional industries, incarcerated individuals, so by about 150. With that, we also saw a reduction in the average days to find employment post-release. So in fiscal year 22, the average days was 32, and in fiscal year 23, it was 26. We saw an increase in employment rate from 79 up to 83%. And then we saw a very minor increase in the highest wage earned. So again, in fiscal year 22, it was $62 an hour. And in fiscal year 23, somebody released with a $64 an hour job. So those are all great statistics. We like to see those numbers increase. We are going to continue to work with ESD as well as internal DOC RDA, research and data analytics, to continue to focus on areas of opportunity for data collection, because data is one point that can tell us the success of programs. So again, that is a focus that we're going to continue to hone in on those types of opportunities. So those were some highlights from the annual report. In addition, we do always maintain a market share report, so we did send that out. And really the importance of that data is just to show, look at the overall gross business income for Washington State and what percentage of the business that correctional industries has. And so, for example, in embroidery, we represent 0.3% of the state's embroidery business. And so we always just want to maintain, we don't want to have, unfairly compete with anybody as, so like, for example, furniture, we represent 0.1% of Washington State sales. So we've also sent out that market share report. So if you have an opportunity to review it, and if you have any questions, we're always happy to go through that information as well. Okay, so next I'll turn it over to Todd.
So good morning once again. Just to give a financial update for the end of our first fiscal quarter for the year. Just to set some groundwork here, the middle set of graphs or lines, that's for where we are currently this year as of the end of September. To the left of that is what we forecasted for this year, and to the right is where we were last year. And so the graphs look pretty similar. We have seen a nice uptick as far as sales. It's interesting that a lot of times when a new biennium begins, it starts up a little slower. That hasn't been the case this year, which has been great. That we've been very busy across all divisions, which has been great. So we have sales better than what we forecasted and what we had last year. However, we do have cost of goods sold, the next line over on each one of those graphs. It's higher than last year and also higher than what we forecasted. There's a couple of drivers there, and I wanted to highlight that for a minute. With transitioning to Microsoft Dynamics 365, we have had some challenges there as far as the reporting of inventory, and are seeing some discrepancies there that we're working through right now to get those corrected. We think that, or believe that we're definitely higher or reporting out higher than where we are currently at. even with that, we're pretty consistent as far as what we show for our net income or net loss in this case compared to what we forecasted. However, with that adjusted, we believe we're sitting about even for the year as of the end of the fiscal quarter. So the hope is that when we report out again at our next meeting and report for the next quarter, that we'll have greater accuracy as far as the cost of goods sold is concerned. But that's just an area we're working through right now. We feel pretty good about where we stand financially. As you've heard a couple of times, we've been able to reinvest into our programs and what we're doing in correctional industries. So just wanted to give that brief report out. And if there's any questions or anything, please feel free to email them to me along the way. But as you can see on the second graphic, we did highlight where the cost of goods sold is right now, and that it is a bit higher than what we had originally planned, but do believe that will come down and correct over the course of the next 3 months. The next section, I also have purview over license plates, and so I spoke a little on this during my division update, but the new license plate shop, as I said, we're hoping to be completely operational come next month. So what you see pictured there on the left are 2 blanking lines in the new shop, and then on the right are 2 digital printers that are in a separate area of the shop that it has to be climate controlled and things like that for that piece of the operation. We have ran into some delays as far as requirements around the building that we moved into, but we're working with capital programs in order to get those different pieces taken care of and wiped out. And working with capital projects on something as a project as big as this, it's interesting and it's a challenge because there's a balance there between what our program is and the programming we would do in a space, but also the space that we exist in. There has to be coordination with the facility and with capital programs when you start looking at HVAC, heating and air conditioning for an area, ventilation for an area to have it, like I said, climate controlled. And that goes for any of our areas. If we look to make any changes or improvements to the working environment, there's quite a number of steps to go through in order to make those improvements. We have, like I said earlier, we have had a few IT setbacks, but believe we'll have those addressed over the course of the next 2 weeks. We will have the vendor back out to come back and do the IT piece as far as getting the programming and things tuned in for those machines. Like I said, the contractors and the subcontractors on this project should be wrapping up by the end of the month with any ventilation work that needs to be done, and staff training. That began a couple of weeks ago when the vendor originally got the equipment installed. It was just mostly testing and showing them how the equipment works. When they come back next week, it should be more on live orders, which is very exciting because we definitely want to be producing all the plates in our new location, and we're excited about the opportunity that it gives that area of the facility as well. It gives a lot of opportunity for work, and like Jamie spoke of earlier and has been spoken of in here, just to build on those hard skills and also soft skills in that area. And there's a lot of excitement generated around moving into the new location. So that's the report out on the new license plate shop. And thank you.
Senator Wilson?
Really quickly, I just want to say I took Human Services Committee from the Senate out to Walla Walla, and it's really exciting to see the space because when we went out there, none of the machines were in there. So to see the progress, really, even with the delays, I'm excited to see that move forward. So the committee was interested and excited too to see the work that was happening as far as the industries around the digital plates. So just wanted to share that, and thanks for the information today.
Well, thank you. And I believe Jamie will speak on this a little bit later, but we're hoping for opportunities for people to get out and be able to, our committee members, to come out and visit the new area and see it work, see it in action.
Yeah, and with that being said, Senator Wilson, I think it was shared at the last meeting that in 2023 was 100 years of Washington State Penitentiary doing license plates. And so we're hoping to have a celebration sometime in the spring when the new operation is open, and it would really be a celebration between Department of Corrections, Department of Licensing, and so of course we will share that information with our committee members just to celebrate that interagency partnership. Yeah.
That is quite a milestone. That's awesome.
Yes, it's very exciting. So, okay, Vicki.
All right, part of our old business that Todd and Jamie briefly spoke on earlier, Textiles Division recently hit their 60-day stabilization period for D365. So, with that being said, I'm excited to announce that we are introducing a new application. Next week we have a 2-day workshop for RF Smart. That is an independent software application that integrates into D365, and it's an upgraded software that incarcerated individuals will learn and use, similar to like a scanning and material management application that's conducive out into like a distribution type warehouse. So with this solution requirement workshop next week, the vendor will be coming out, working through 9 workflow items: purchase order receipt, material management, movement, inventory, picking registration for sales orders, and for production orders. We will be working through that. 95% of that configuration will be completed next week, and then we'll come back and then we will roll that out to individuals. They'll be using handheld scanners, learning that new application. It's really part of what we do, training individuals for all these updated applications for post-release. Things like, scanning in Amazon, the larger distribution industries out there. So really excited to be able to roll out that headquarters pilot for D365. Part of your materials, we have our timekeeping application that we'll be we're working on in parallel with an NMB parcel shipment program. That's another independent software program, similar to what FedEx or less than truckload contract carriers use out in our distribution warehouse areas. And then you'll see the next lines of business: food manufacturing, Jamie spoke of. They're working on the simulation environment for frozen foods. We've picked the frozen meal lines to just update the data, take a look at the bill of materials to see how that program is going to operate from a production standpoint in food manufacturing, and then also optical and commissary for that material management piece. So it's been a multi-year endeavor, and we are progressing with each line of business through the schedule.
Okay, thank you, Vicki. And I know on today's agenda we had a guest speaker scheduled, Ms. Long. She was unfortunately unable to make it today, and I know our meeting is coming to a close. Anyways, and so I just, in closing out today's meeting, and we can take any other questions that you guys may have. In 2024, we will be undertaking kind of that general revision of the advisory committee bylaws. So we'll work with our committee members to schedule meetings for a special committee to be formed at our March 21st meeting to talk about the bylaws. We do look forward to seeing everybody at the next meeting, which is in March. Of course, if between now and then, if you have any questions or would like additional information, we're happy to schedule time independently with anybody. we also do want to put it out there that, again, for site visits for 2024, we're really proud, and the incarcerated workers are really proud of the work that they do, and we would love to schedule meetings or site visits with any of our committee members to tour any of our shops, whether that's in Eastern Washington or Western Washington. So, please feel free to reach out if that's something that you're interested in seeing, and we can work with our committee members on that. Also, if you have feedback for us on the format of the meetings, we're presenting a lot of information to the committee. We know that it's a lot of information in this 2-hour meeting, and so again, we're open to feedback. If you have if you'd like to see a different format or different types of information, again, we're happy to discuss that as we want these meetings to be beneficial for all of the committee members as we move forward. So at this time, is there any additional questions from any of our committee members before we adjourn the meeting? Okay. So again, we appreciate our new committee members for being here today. We know, especially with the holiday season and the closeout of the year, we appreciate the time. We look forward to seeing everybody in the new year. And we just hope that, however you choose to celebrate, we hope everybody has a wonderful holiday season. So with that being said, please notate in the minutes that the meeting is adjourned at 10:52. Thank you.
Happy holidays, everyone.
Happy holidays. Thank you.